2, 1.
Right now at 5:30, it was history in the making for our community. Such a great day. 1 month ago on November 11th, it was the first day of accepting patients for the new Norton West Louisville Hospital.
That's right. It was a great Friday morning, and after cutting the ribbon 3 days earlier, it is now the first modern hospital ever to be operating in the West End. So now, with 1 month of business under their belts, we wanted to know, how's the hospital doing? And joining us to talk about 1 month since its opening is the Norton president and CEO, Russ Cox. Russ, thank you for being with us. I know you go to the hospital a lot. How's it doing? Who's coming to it? I know you know what zip codes and what communities they're being treated from at Norton West.
Well, first, thanks for having us here, and happy anniversary, happy birthday to Norton West Louisville Hospital. 1 month. It doesn't seem possible that it's been 1 month, but it has, and we couldn't be happier with how this facility's been received in our community, how people are really coming here, and how the design that we put together in concert with the community at all the sessions that we had with the community about what would you like to see. Not only did they tell us, but they've embraced that as we've seen it grow. So
where are the patients coming from? Do you know what neighborhoods?
They're coming from all over the community, which is good, because we've always perceived that this facility was going to be one that would be an asset to the entire community. Now, the majority of the patients that we're seeing right now are coming from the West Louisville area, but we've seen people from Louisville's East End, we've seen people from Southern Indiana, and we've seen an interesting dynamic too, from the standpoint that people who perhaps have never been in West Louisville before are now understanding that there is access available, and maybe quicker access. We had someone today that scheduled an MRI because they could get it done before Christmas, and in the other facilities it was going to take a bit longer. So when you increase that access, you create more capacity, because it allows more capacity to be generated in the system.
Now, I know you're only a month in, so it's hard to ask this question, but what are you seeing as the biggest need so far in the first month?
Well, there's no doubt about it that the unique model of being able to treat pediatric patients and adult patients in the same facility has certainly been embraced. Okay. We've seen a whole lot of business that has come through the emergency department that's related to respiratory illnesses, and particularly in the pediatric population. But it has been everything that the community told us they wanted to see. It's been specialty care around cardiology, around neurology, around orthopedics. So we're averaging somewhere around 50 to 75 people a day in the ED.
So now you're 1 month in. I've been curious of whether you know yet whether this is a national model. I know before you opened, I interviewed Devon Holt, who used to be with the Goodwill Opportunity Center, and he said we had over 30 other Goodwills around the country come to Louisville to study our operation. What do you know about the healthcare side and being unique?
Well, we think that it absolutely is a model that can work throughout the country, and we think that the success that we're experiencing early will create a whole lot of people coming to us and asking how, why, and what did you do. I think what's unique about our model is that we have a partnership with Goodwill. We're very good at the acute care services. We're very good at making sure that people's healthcare needs are taken care of. But in our world today, the needs of our patients are greater than just healthcare needs sometimes. There's social services that are needed as well. There's things like Dare to Care as a partner, being able to provide a food pantry within this facility. So we believe that what makes it a national model is not only is it a partnership, but it's a geographic partnership. We're on the same block, the same city block at 28th and Broadway.
Do you believe it is one of a kind? Is the only one out there now?
Absolutely. We have searched high and low. If we could have found a model in any other community that we could have learned from, we would have. But we couldn't find that, so we created our own in concert with partners like Goodwill and Dare to Care and others that have really come forward and said we want to be a part of this.
So do you find that community aspect is bringing people in, like they're not afraid to go to the hospital?
I absolutely do. And I think that the facility itself is a very welcoming one. And the fact that the community had such a hand in designing it and planning it and helping us execute on that has been a big part of that. One thing I know for sure is that the 325 people who work in that facility believe that it is the best facility that anybody can come to, and want to create a culture to build trust.
You designed it to be a preventative care hospital because you only have really 20 beds. Do you see evidence that it's already doing that?
Absolutely. We've done about 1,800 diagnostic exams so far, and this is just in a month. And as I mentioned, we've seen about 1,200 come through the ED. We already know of situations and circumstances where people have come in, for example, a mammogram. We've been able to diagnose it at stage 1. in the past, that person who came to this facility might not have come to this facility. But the fact that it's there, it's convenient, it's in the community, they've come there, we've been able to diagnose that at stage 1. Their chances of recovery go up exponentially. We're able to catch these things earlier, and that's what access really does, is it provides an opportunity for us to get to that prevention mode. And Doug and Connie, my desire is that we don't need 20 beds. You know, the best design that we can have is to have a model that is prevention, that it's early intervention, and it's education, so that we don't have to use those hospital beds.
Obviously a good Christmas gift. Merry Christmas to you, and thanks for coming in for the update.
Hey, thanks. We'll be back in a year to tell you more good things.
We'll put it on your calendar.
He said it. Thank you, Russ. Well, you can find the Norton West Louisville Hospital on South 28th Street. For the type of care the hospital offers, just visit its website at nortonhealthcare.com.